Breast cancer in younger women is not the bulk of people we see. Only about 20% of cases occur in women less than 50 years of age, and very, very young cases are rare, but they still occur. And breast cancer in younger women comes at a time in life when these women are having children, are in the peak of their professional careers. They may have elderly parents or other people that they have to care for. So they have a lot going on in their lives, and they're scheduled and multitasking and doing lots of different things. And then all of a sudden they're told, you've got cancer and you've got to stop everything. And you have to go ahead and, arrange for what kind of treatment, make decisions about what kind of surgery, and really go through often a year or more of toxic therapy that can drag you down while you're doing this to prolong your survival. So it's a very difficult time in life. And we also know that younger people in general, and especially younger women, have a higher risk for depression and anxiety, just at the general societal level. And then if you add on the cancer and the stresses of the treatments and difficulties that they face, often going into menopause acutely as part of giving chemotherapy to these women. And then often we use ovarian suppression therapy because this is more effective in younger women. So these women are pushed into menopause from being premenopausal, now becoming menopausal, having a lot of symptoms associated with menopause. So there's so many things that they have to deal with. And as with Olympia, the trial I just discussed with you, many of them may be gene carriers. They may have a hereditary predisposition. So having surgery that requires bilateral preventive mastectomies, oophorectomies that are done, again, contributing to their sense of well-being, their body image, disruptions in their sexual life. All of these things are very, very profound. That's not to say that these don't also affect older women, but older women often, again, they've raised their children, they perhaps finished their professional careers, they don't have as many day-to-day demands. And they also have friends and colleagues who've had breast cancer or other cancers. So they kind of have seen what's happened, that they've survived, that they've done okay. But for a 30-year-old who knows no one with any serious life-threatening disease, it's a really dramatic time for them to have to go through this. And if they're not partnered and don't have much social support, it can be even more challenging.